Health TechNet presentation is being recorded, so just be forewarned. I live in a two-party recording state, so therefore I must allow people that information. For the benefits of those that haven't been on before, and for our moderators and guests, I will try and manage. You have your own control over your microphone. I will be spotting and looking just in case you've got it on by accident. I do understand that happens, but I will mute you. You should still be able to mute yourself. When we get to the Q&A session, please raise your hand or somehow note that you want to ask a question so that we can try and coordinate as much as possible. The chats, as best as I can tell, are still not private, although Zoom has created a slightly new infrastructure, and it does appear that private chats are now private, but I would still caution you that they may not be. They may show up in my logs. I don't want anybody to sort of reveal information that they shouldn't be. Not that that typically happens. Please keep it all appropriate and so forth. You are allowed to join more than once, as Joe has clearly done. He's on the call twice. I see he's just that committed to such a great experience. So without any more faffing around, I'm going to hand over to Jim Oates, who will take us away.
Well, hello, everybody, and glad you can join us. After, as a number of you know, we had a really interesting joint program with George Mason University last month on the topic of cybersecurity. And so when the possibility came up of having a discussion today on ransomware, it seemed like one of those things that just fit beautifully. So we have two really interesting speakers with some significant expertise in the area. Gina Greenwood is a partner with Nelson Mullins and is co-chair of their data breach response and investigation team. Gina will be presenting from their Atlanta office, and we're delighted to have her. We also will have Brian Gallagher, who's spent a decade with the U.S. Secret Service and went on to a career as an internationally recognized expert on security and risk mitigation. Co-founder of both CodeLock and Protected by AI, where he leads teams committed to protecting people and property and places and profits. And he's co-written an Amazon best-selling book called Stay Cyber Safe. So we're looking forward to hearing both of them. And as a lead up to that, I want to turn it over to Richard Singerman, who's going to moderate the discussions today. Richard has some kind of introductory thoughts, and we'll kind of drive the program from there on. So over to you,
Jim.
Yes.
I'm wondering if, especially since Linda is on the call, you want to highlight our next meeting in November briefly.
Thank you. Yes, I will do that. And that's going to be really interesting. Linda has arranged for us to get an in-person tour of JLabs, which is the Johnson & Johnson Innovation Center at the old Walter Reed campus. There will be several, since we're still in this weird world of having to negotiate masks and COVID restrictions and that sort of thing, there will be a limit of 40 people that can attend. So as we come closer to the date, we'll get that out. We will serve lunch. People will have to show proof of vaccination in order to attend, but the time will include both a fireside chat with Sally Elaine, who's director of JLabs here in Washington, and a tour of their innovation center. So we're pretty excited about that. That will be on November 12th rather than the third Friday. So look for more information on that. And thanks to Linda for doing so much work arranging that.
My pleasure.
Thanks for the reminder, David. Okay, Richard, over to you.
Just one point, there will be no Zoom for that, just in case anyone's wondering or hoping.
And apparently the facility is not metro friendly.
Okay.
So if someone...
It's located up in the northern part of the district. Is that correct, Lynn?
It's a couple of blocks off of 16th Street. It's around 13th Street and close to the Silver Spring border.
Okay. So, but there is a parking garage nearby.
There is a parking garage literally just across the driveway from them, and it's free.
So you'll get an email from Jim and me and Linda right at the beginning of November that'll have all the logistical details.
That's great. So, because for instance, I mean, I live not too far from there, and I think of Walter Reed as actually accessible from 16th Street, but it's a big place.
Well,
Okay.
it is accessible from 16th Street, but it's a long walk from 16th Street to the building.
Great,
So,
right, thanks.
you know, it depends on whether or not someone wants to walk it or not.
Okay, and if anybody has too much trouble, they can just set up a ransomware attack on the program, because we're going to be learning how to do that today. So, so Richard?
Great. Hey, Nick, can I share my screen for a second?
Absolutely, you have control.
Okay, so I'm just going to share this one thing here, folks. I'm just going to talk for about 3 minutes. Can everyone see my screen?
Yes.
Okay, so I'm, normally I've been with health tech for whatever, 10, 15 years, and I love to be part of the thought leader community on that. But today I'm really going to speak to you from the patient or parent perspective, because there was an article I saw a couple of weeks ago, which really hit very close to home. So, and then it sets up hopefully the topic with a very down-to-earth way of looking at things. So I read this article at Wall Street Journal a few weeks ago. A hospital hit by hackers, a baby in distress, the case of the first alleged ransomware death. So this was a story of a young woman who was giving birth, here she is, and in an Alabama hospital. And for those of you that know, usually when you go to get your baby delivered, the woman, she goes into the room. For the case of my situation, I have a 12-year-old, 16-year-old, they're very happy, destructive teenagers, always wrestling, always healthy, is great. But when my older kid was born, it was at Sibley Hospital, a lovely suburban hospital, part of the Hopkins network. And you go in, they wrap a monitor around the mom's stomach, and it's a fetal monitor. It measures the baby's heart rate. So what normally would happen is, this is kind of a normal standard thing to do. So she would have normally gone into the bed, had that wrapped around her stomach, and there would be a whole monitor where all the different nurses watch all the different monitors going on at once. Well, because of a cyber attack, that was not able to happen. And so instead, the individual nurses were just basically sitting outside the door of various hospital rooms, and her baby went into distress, but it didn't signal an alert. So by the time the baby was born, it had been severely oxygen deprived. And despite all the best efforts, about 9 months later, the baby had severe brain damage right away. And 9 months later, unfortunately, the baby died. And to really bring that close to home, in my situation, for my older son, Zach, who's now about 140 pounds and 5'6", with feet already bigger than mine. And I'll stop sharing now. So with Zach, he went in, the monitor was around the stomach. Now, even before he went there, the doctor is about 2 miles away. He's getting individual telemed readouts at his office for all his patients who are pregnant. So every time, when the water broke, we went to the hospital, every time mom pushed, the baby's heart rate suddenly spiked on the monitor like clockwork. And all of a sudden, the doctor was happy-go-lucky for the first few hours there. He bought pizza for all the nurses, I kid you not. Everything changed in a heartbeat. All of a sudden, game face on. They called in a neonatal specialist, and that room was like another world for 15 minutes. And every time every time there was a push, spike. So what that means, the heart rate's going up because the baby's not getting enough oxygen. And the doctor suspected from this reading that he was getting, because he had access to the monitoring data, which this poor girl in Alabama did not because of the cyber attack, which knocked out all their systems. So the doctor basically took an educated guess that the umbilical cord was wrapped around the baby's neck in the womb, and every time there was a press, it pulled on the umbilical cord, which constricted the neck, reducing oxygen flow to the brain. And sure enough, when the baby was born about 3 minutes later, and I will never forget this sight as long as I live, my kid came out, and the umbilical cord was wrapped around his neck like a noose. Thank God, everything was fine, everything worked out. However, if that hospital had been subject to a ransomware attack and they didn't have that information and they didn't have the corresponding neonatal intensivist ready, like passing off the baby like a football with 1 minute's notice, 30 seconds really, just pass the baby along to check on how the baby was doing, check on how mom was doing, things, God forbid, could have turned out very different. So as not only a patient, but in this case, a parent of a patient, this was a really meaningful article on how ransomware could really made things very different. So I know we always think about 20,000 feet high level view, but I want to set up our speakers really thinking that this really is a very real situation and could happen to any of us anytime. So with that, I'm going to moderate Q&A at the end, but I wanted to kick that up to our speakers. So go ahead, Gina.
Okay, thank you, Richard.
Sure.
So Gina, over to you. And you're muted there.
There we go. Can you guys hear me?
Yes, we can.
All right, I'm going to try to share my screen. My name is Gina Greenwood. I'm with the law firm of Nelson Mullins, and I appreciate my law partner, David Mame, inviting me to participate with this very distinguished group. Let's see if I can manage to share my screen. Can you guys see that?
Not yet.
No.
Okay.
There we go.
How about that?
Yep, terrific.
All right. Okay. Today, thank you for the eloquent introduction. I just want to repeat kind of who I am and what I do and the perspective that I bring to the audience today. I actually co-chair the data breach prevention, response, and investigation practice here at Nelson Mullins. We handle hundreds and hundreds of cyber attacks and also paper data breaches for all kinds of entities across industry sectors. I have actually a very deep understanding of health. I grew up at Austin and Byrd in Atlanta, Georgia, was a big AmLaw 100 law firm in the health department. And my first week of work, my job was to figure out this little law called HIPAA and see if it had they didn't really think it was going to be that big a deal, but we had a multi-million-dollar contract with the hospital association to draft policies and procedures. And then I'm going to date myself, but 20 years ago, we were on Blackberries that was our form of cell phone communication. And so I was the HIPAA helpline for that huge law firm for the next 7 years. And it taught me so many different things that are coming into play with regard to breach notification. As you fast forward and get beyond data privacy and security compliance and move more into data breach notification and trying to prevent those situations, that deep background and not only understanding the HIPAA regulations, the privacy regulations, the 50 states laws that we have to comply with, but also international laws that we have to comply with as health entities in this country. It gave me a very good background of also understanding how CMS, as well as the EMTALA enforcement agencies, how that's going to play in Joint Commission, DMV, those accreditation organizations when you're under an attack. So unfortunately, I've got a lot of lessons learned to share with the group, and I hope this will be informative to you at a different level. All right, so that's me. Like I said, I think I've already been through most of these. EMTALA comes into play a big deal in these data breaches and these ransomware attacks for healthcare entities because of the emergency management and transfer obligations that you have as emergency rooms in this country. And so we'll talk a little bit about that as we go through how that can play into, a response to a ransomware attack and some things that you might be considering to the extent you are helping and assisting a health entity in one of these charges. All right, this is just a brief introduction to my team to kind of tell you who we are. We offer 24/7 breach response services. We answer the phone 24/7. Be sure to jot down my phone number and our breach hotline, just in case you ever get in a situation where you need some help at 2 o'clock on a, July 4th, that's when they usually attack. It's not 9 to 5, Monday through Friday. So we're always available and happy to help. We work from a larger team of professionals that are also available to assist and are always, willing to answer questions or even if you're not directly engaging us. So one of the main things that I always want to focus on when we're talking about ransomware attacks is some of the risk management strategies. So, Richard has done a great job highlighting for us the true and imminent risk to patients, babies, even mamas and babies, but patients that are lying in the beds. We have had ransomware attacks where operations are in process. People literally are lying with their guts out on the table, not to be graphic, and they have to close up these humans and move them on up the street because they cannot finish an operation. But trying to deal with the fallout, the human fallout of that, the safety risk of having to manage patients when you have patients appearing in your health facilities and you do not know who they are. They're showing up for emergency procedures, or they're showing up for elective procedures or ambulatory procedures, and you have no idea who these people are, and they're showing up, and how embarrassing that is for a health entity when they don't have any other form of record of that patient. But not only are we managing the safety risk of the patient, but we're also managing the headlines. As we all know, unfortunately, the plaintiff's bar is all too willing to descend upon any entity that has an attack like this. And so trying to keep our entities out of the headlines, the break the bank kind of headlines that will cause a class action litigation lawsuit to ensue, is a large part of what we're doing, is managing the messaging, particularly when you have guidance from OCR and requirements, legal requirements, that you do notify media affirmatively in the event of some types of attacks. So this is always a big challenge, and we see a constant barrage of cyber incidences, paraded through the different newspapers of the world. The types of responses that we are seeing, and the ones that are troubling us the most these days, are the supply chain catastrophes. The exfiltration of data from ransomware attacks is the norm now. In my 20-year career, 2 or 3 years ago, a ransomware attack, I loved getting a ransomware attack. It was the easiest kind of cyber event I had to deal with. Basically, bad guy got in, locked up some systems, asked for a $20,000 demand. Most of the time those demands were made because it was just a no-brainer. You paid it off, you got your systems unlocked, and you were moving on. And there was not really a big concern about exfiltration of data. As these laws have evolved, and as ransomware attacks and the forces that are at work, the bad and evil forces that are at work with threat actors, we have seen this rise in ransomware attacks where there's almost 90% of the time an exfiltration of data, and that takes it to a whole different level. From an Office for Civil Rights perspective, a HIPAA perspective, HIPAA HITECH Act, there is a presumption if your organization is attacked and you're a HIPAA covered entity, that there has been a notifiable event, that you have had a data breach, not just a security incident, but a legally notifiable event. And if you think about with a hospital who deals with millions and millions of patients every year, this can be catastrophic from a PR perspective, but also just having to manage the messaging of all that. The hysteria and also the class actions that loom in the background of having to notify an entity just because you've been potentially infiltrated by malware. And so from a cybersecurity perspective, what our goal as lawyers is to prove with forensic help, forensic scientists, we get in there, I'm sure some of you are these people, we get in there and we determine whether or not there was actual human access to PHI, to protected health information, or PII, personally identifiable information, to a degree, whether that's employee data or patient data, to a degree that requires a notification. And one of the main ways that we overcome the presumption of having to notify patients is if we can show on paper that there was no access to by a human being or exfiltration of PHI or PII. So that is getting that conversation from a legal perspective. More and more we're having to send notifications now, because in the olden days of where it was just malware, really ugly malware running through your systems and locking them up, now we're seeing the type of malware that and human interaction that they're actually exfiltrating data, sensitive data, in order to post it on the dark web, to post it for sale, to post it for harassment, to post it to try to get the bigger ransom demands. So whereas 2 or 3 years ago we were looking at maybe $20,000 ransom payment was very, very common. 22,000 for some reason was a magic number for many years. Now we're seeing upwards of 5, 7, 20, $30 million ransom demands on the first ransom. We use professional negotiators to talk to threat actors to gain intel to decide whether or not a ransom payment will have to be mandated or not. This is all done in compliance with the OFAC, the Department of Treasury, and other federal guidance. None of us look good in stripes or orange, so we will always want to make sure to comply with federal guidance if you are negotiating, and to make sure that you're not negotiating with a terroristic organization. We have seen a lot of events in the past 365 days associated with the Blackbaud attacks. That was the nonprofit entity. It's a vendor of many healthcare systems that was attacked, that caused massive notifications to have to go out around the world for both universities as well as hospital entities. The Solarwinds attack, which is more related to governmental things. The Microsoft Exchange attacks, and the COVID, the working from home has just been a constant issue in the past year of trying to secure systems from outside attacks. Losses by industry, as you can see, 22% healthcare. I'm surprised it's not a higher. This is from Beasley, some statistics that they give us. We still are seeing a large percentage of claims associated with network infiltration, as well as vendor issues. So learning to vet your vendors, your business associates, as we call them in the HIPAA world, and make sure that those guys are as secure as you need them to be, so that if you are in a situation where they are attacked, it gives you a better defense to why you did business with these vendors to begin with, but also to try to help secure your systems where they're not infiltrated to begin with, to make sure they have multi-factor authentication in place, they have endpoint monitoring in place, they have some basic protections that we often see lacking when we are dealing with a ransomware attack. I thought that one of the things that might be helpful, I'm not sure where my slide went on this one. Let's see if it'll come up. It's not going to. This slide was supposed to be an explanation of the stages of a ransomware attack. And so I thought it might be helpful for you to understand the stages of a ransomware attack. For those of you who have not been through one, they are horrendous. It is very much a criminal attack of your systems. If you think you're getting your house or your car broken into is invasive, you should go through one of these things. It really feels dirty, it feels icky, but if you understand kind of what is happening to you as an organization, I think it helps you make some strategic, legal, as well as other decisions when you're trying to deal with a ransomware attack. I want to be clear that the federal government does not advise paying ransoms. They feel like that will lead to additional extortion demands. And in order to get your system in a situation where you don't have to pay a ransom, it is very important to have viable backups. In the healthcare world, we find that to be typically a read-only type of EMR, where the organization can get to information in the event of an attack, so they have time to recover. But oftentimes we find that there's no option but to pay the ransom. Many backups in the healthcare world are backed up about every 24 to 48 hours. One thing that we're commonly seeing is that the hackers are actually infiltrating the backup systems as well as the main servers. And so it is almost, and the malware is going over there that encrypts the backups as well. We are seeing that almost universally now. So the stakes are a lot higher. The ability to pay ransoms, as I mentioned, because of the federal guidance, as well as just the creepiness of it and the fact that nobody wants to pay off bad guys to get your data back. It's not right. We shouldn't have to do it. But unfortunately, we find ourselves in those situations almost daily. To understand the stages of a ransomware attack, the first stage is access. How they gain access is and many of you probably can speak more intelligently to this than I can. But basically, from an outside perspective, we often see those starting from a phishing scam of an email system. Very often, very high-level people give away their credentials accidentally. They get a notice from a bad actor that says, hey, it's time to change your email password. They think they're changing their email password, but actually in reality, they are just allowing access to the old password, because you have to insert the old password and then change the new. And so they're not really changing to a new password, but they're giving away the old credentials and giving away, in essence, the keys to the kingdom. We see brute force attacks. We see entry from vendors coming in that way. We see all different kinds of things. But once they're inside the systems, behind your firewalls, they typically will do a lot of reconnaissance. So they'll do anywhere from On average, we see about 60 days. We've seen as much as 2 years. I've never seen longer than 2 years. I've seen attackers as many as 5 or 6 in the system at the same time. So sometimes when you're looking at an attack after the fact, you're trying to figure out which attacker actually sent me the ransom note. We're seeing commonly that they get in, they recon the data. They are basically data mining, and they're mapping your data to determine where what we call the honeypot data is, the crown jewels are located. The crown jewel data is what they're wanting to exfiltrate, because that's what they can get the higher demands for on a ransom payment. And so very often they'll come in sneaky, recon the systems, and then at a later time come back in and exfiltrate data. It's not noisy. They're not trying to draw attention to themselves at that point. Sometimes they will drop they'll drop malware and they'll deploy different kinds of malware to try to throw you off their scent. But usually it's pretty straightforward. They're just exfiltrating data, dropping the ransomware, which is a encryption software, encrypting your servers, one by one, your files and servers across. And then they're dropping the notes to say to pay the ransom. We often see that, as I mentioned, the exploitation demands have gone from like the $20,000 range to the multi-millions now. Very rarely are consumers and entities in a situation where they have adequate cyber insurance to cover something like this. We are seeing a change in cyber insurance that it's not going to cover ransom payments as much because they got killed last year. We understand that there was as much as a 400% increase in ransom payments and cyber attacks and ransomware attacks last year. And so as you're going through a cyber insurance renewal process, you may find for your institution that you're having a harder time getting underwritten for cyber coverage. And you may find that your premiums have doubled and your coverage has halved. We're seeing that pretty frequently, maybe not in that exact proportion, but definitely seeing that. So it's important to do some things to protect against these stages happening to you. Once you get the ransom demand, you've been encrypted, typically that will trigger someone at the entity to notice that something has happened to them. Hopefully they're reaching out to legal counsel immediately to try to engage legal counsel that is approved by their insurance carrier. You always want to try to get to know your lawyers that are going to be your cyber lawyers ahead of time. We find that often the legal assessment of whether you have to send a piece of paper to millions and millions and millions of humans. And keep in mind, I had one the other day that 75,000 people had a social security number breach, and that cost the company over $1 million just in identity theft protection codes. So a multi-million patient data breach is very, very costly to an organization. And if you can find a legal analysis that does not require notification, if that is ethical and truly what happened, if there's low probability of access to actual PHI, obviously that would be a place you'd want to be. In order to get those
Gina?
Yes.
It's David Main. Just a real quick question on your comment relating to insurance. Does the premium vary depending upon the nature of the organization and the precautions that have been taken? In other words, to the insurance companies, are they evaluating how likely you are and how well to get an attack and how well protected you are?
Absolutely. I am not a broker, an insurance broker, but from what I hear on the street and from presentations by insurance carriers and their underwriters, that is exactly what they're looking at. If they will insure you at all, many of them are just denying coverage altogether. But those that are allowing coverage, they're definitely looking at the risk and assessing the level of premium and coverage based on the level of risk at this point.
Okay, thanks.
Mm-hmm. So hopefully once you've been attacked and started to see encryption running through your systems, hopefully you've engaged legal counsel to pull that investigation under attorney-client privilege. One of the things that we're seeing very often now with the increase in the underwriting requirements, many underwriters are requiring, cyber insurance carriers are requiring endpoint monitoring, which I think is absolutely essential to protecting against ransomware attacks. You absolutely, homework assignment, make sure you have very good endpoint monitoring, 24/7 human monitoring of the logs and the data that's coming out of those systems. But because they have eyes on your systems, they're going to have some data that may or may not be protected from discovery in the event that you get sued after the fact. And so if you have constant monitoring, by an outside company like a Mandiant or something like that, CrowdStrike, then you have to be sure that when you flip over to a forensic investigation of a ransomware attack, that you call those lawyers and make sure they invoke that privilege very quickly, because if you don't, all those documents and all that documentation could be subject to discovery, and it could be anyway, but it's your best shot at trying to protect what happened. Because one of the things that we find, and from a legal assessment, is you rarely ever know what happened to you in the early stages of a ransomware attack. It really takes a thorough investigation by forensics to understand. And so some of the first communications that are coming out of the organization, they might be calling something a breach, which would mean you need to send a paper notice to millions of people, when it's not really a breach. It is a security event, or it's a security incident. So you want to make sure you're careful not to use terms that trigger legal notification obligations. But if those emails become discoverable, either under an Open Records Act because you're a county hospital or something like that, or because of litigation, then it's important to try to pull those under attorney-client privilege to keep that from happening, so that those initial correspondence are not out there for the public to see and scrutinize in the media. Once we realize that you're under attack, we will bring in forensic examiners who are highly skilled at figuring out, first of all, stopping the bleed, making the encryption stop of the systems, keeping it from going to the backups if at all possible, assessing what happened to your organization, mitigating that damage, giving you recommendations going forward, and then also writing. We would come back in as legal to write notification letters that are compliant with all 50 state laws, as well as any foreign laws that may be applicable, and of course as well with HIPAA. Notification under a HIPAA standard would require a press release go out if greater than 500 people are involved. You'll have employee communications that need to be made to help people understand what happened, and managing that from a social media perspective is always a nightmare. OCR investigations and lawsuits. So once you are under a ransomware attack, there's this 3 or 4 different parallel investigations that are going on. You've got a forensic team in there that are looking at your systems, trying to tell you what happened. You've got a hostage negotiator that may or may not be reaching out to the threat actor to try to see how much you're going to charge me to unlock my systems, but also to see what data do you have and what are you planning to do with that data? Are you going to post it? You're looking at Tor websites to see, has that data been posted on the web? And you're using all the information you're getting from your forensic providers and your legal team to try to help you decide, how much communication do I need to be doing with this threat actor, not only to potentially pay a ransom, which you don't want to have to do unless you absolutely have to, but also to mitigate the risk to my patients and to my employees that their data might be going up on some dark web. Are there any questions at this point? That seems like kind of a good stopping point to ask some questions.
Hey, Gina, I'm gonna ask just because it relates to first of all, can you hear me? Okay?
Yes.
Yeah, just going to ask because it relates to the article that I mentioned. At the end of the article, it mentioned that the patient is suing both the doctor and the hospital, because she said the hospital should have notified people in real time that they were then going to a hospital with compromised computer systems. Meanwhile, the doctor is suing the hospital because he's saying that if he had known from the hospital that they were compromised, he would have, let's say, maybe done a C-section earlier, this kind of thing. So what about real-time notification?
Yes, well, it's a great question. So ideally, in a ransomware event, you're holding off on notifying until you know what happened to you. This case really does highlight for the world that we may have to rethink that a little bit and do some real-time notification. What we have always recommended to our clients in the healthcare space is to run devise incident response plans in coordination with your medical staff that really truly assesses your service lines, that looks at obstetrics, that looks at oncology, that looks at cardiology and neurology, and determines for each service line and each type of patient, are these patients that in the event of not having access to certain kinds of data that we should go on diversion, that we should be transferring, that we should be potentially notifying the public that we are not in a situation to be able to receive patients at this moment. In the past, we have found that this is much more complicated than what you might imagine. Let's take, for example, that case. I'm not familiar, that is not my client, fortunately, and I'm not familiar with the facts, the intimate facts of that case, but I'm going to make some up just for scenario purposes. Let's say you have a patient who has already begun delivery and then you come under a ransomware attack, or maybe it's a high risk patient. You have to assess the risk to that patient individually. Is it more dangerous to put that patient in an ambulance, either by airplane or by bus, and send them up the road where they might deliver en route where they have absolutely no personnel, than it is just to keep them there and do the best you can. So I think, all those are allegations that we're seeing in a newspaper and in complaints, but I would suspect that there were other things at play that might have led the decisions to keep that patient. And I think, to be fair to that hospital and that physician, we should consider that. But I can tell you, in real time, it is not fun. It is not pretty. You will also have, CMS descending upon you, your accreditation organizations, and you're trying to deal with all that, and yet, keep patients safe. So, I'll give another example: an oncology patient with a rapidly progressing form of cancer. Do you keep that patient where you have no data, you don't even know what the cocktail that they're supposed to be getting, or do you send them up the road to another, oncology, radiation, or whatever provider? Sometimes we found in those situations, when you're looking at real humans and real people and real fact scenarios, that even if you have no electronic data, you might have more data than your neighbor would have if you tried to divert that patient and send them or transfer them. So sometimes just the historical knowledge in the heads of the practitioners is better than nothing. Other times we've been able to stand up read-only EMRs, where doctors can get access to those read-only to see what that data looks like. But it is a very real question. And I think that article and that lawsuit will probably lead to a lot of, different types of monitoring being put in place, would be my bet for different types of scenarios. Any other questions?
Yeah, Gina, hi, this is Joe Bormel. I'm interested in whether the ransomware events are in any way related to the protection you get if you're a patient safety organization, a PSO, in terms of your discoverability situation.
Okay, can you repeat the question?
Sure. So there, in terms of patient safety, there was a federal law in, I think, 2005 that it was to basically to counter the Florida trial lawyers to make patient safety data non-discoverable, so that organizations could do. And I'm curious, because we're describing a lot of scenarios where these things would create patient safety problems for and risks for patients. And I'm interested in whether a PSO status protects you from discoverability.
That's a very good question, and one I'm going to research after I get off this call. I don't know the answer, to be honest with you. I do know that, we have tried to pull things under quality reviews, and like, for example, in Georgia, we have some very good patient safety laws, even in Georgia, that can protect some data, but I don't know the answer to your specific question, but it is a great thought. And I'm putting a big fat star by it to ask some of my Florida litigator friends. Any other questions?
Yes, I have a comment and a question.
Yes, sir.
What is the point of entry that you found is the most common point of entry for these ransomware? In other words, are they devices? The reason I'm asking this is I was at a recent webinar, and they pointed out that you don't do microsegmentation for radiologic devices that are vulnerable. And I'm looking at a study, a recent study showed that in 2018, we had 56% of internet connected medical imaging devices that were vulnerable to attack. And in 2020, that was 83%. So what are you finding that these medical imaging devices are very vulnerable from what you're saying?
Yeah, I have not seen one associated particularly with a medical imaging device. I've seen them all across the board as part of the point of entry, everything from they're doing things like what do they call it? Credential stuffing campaigns, where they throw a bunch of credentials that are used over multiple platforms at the at the point of entry that way. I've seen phishing scams. I've seen internet connection problems. I've seen, failure to patch issues. I have seen a lot of just giving your credentials away, email credential harvesting scams, usually by top IT people with admin credentials. That is what I mostly have seen. But I don't know that I've ever done like a survey to try to figure out which one is most prevalent. I will tell you that almost universally, no multi-factor authentication is available, no endpoint monitoring. Those are the two things that I see almost universally as a recommendation post ransomware attack, that if they had it in place, it probably would have made a big difference.
Okay, thanks. And this is a comment regarding the previous question about the price of the coverage for ransomware. So that a lot has changed. Excuse me. I provide a service where it's web-based for light EMR to hospitals, and a large client of mine every couple of years would use a product called, I think, HP Invert, would audit us. And my insurance never cared what they were doing, but I think their insurance did care. But at some point, they ironically stopped using this, and I haven't been audited in a while. And about a couple of months ago, this large hospital actually got hit with ransomware.
Oh, wow.
And now my insurance company is asking questions about how they audit themselves and so forth. So, it all depends on what you're really involved in. And previously, the insurance companies didn't ask for the web-based EMRs to look into their to evaluate the vendors.
Right. Well, you're right. I mean, you're going to definitely see a very strong enhancement of the underwriting process for all kinds of entities. Anybody that's housing electronic data that has any kind of sensitivity at all. So I think that's probably a trend that you're seeing, and it is interesting that the change and all that. One of the things I also would recommend is developing an incident response plan. I think I said this earlier, but I just want to make sure that factors in your insurance coverage and who you are allowed to use in the event of an incident. So what we often find is, let's say I have a client that I write their policies and procedures, but maybe the insurance policy that they picked doesn't have us automatically approved for coverage for them to use us. And so they end up using some stranger, law firm or some stranger vendor that doesn't know anything about their systems. Ideally, you want to build relationships both with your forensic vendors as well as with your law firms ahead of time, and write that into your incident response plan. Do not ever mention insurance in an incident response plan, because that can actually be used against you, because that's one of your policies that might become discoverable, and you don't want the fact that you have insurance to be used against you for any kind of fines or penalties or some sort of damages to be assessed. But just know that you really need to consider all those things ahead of time and try to engage with these forensic providers. And I can certainly recommend some very good ones, ahead of time, so that you're not contracting for 2 days and trying to get your BA agreement approved or whatever with these outside entities, and you've got ransomware just running through your systems. You can't get any help. But I would strongly recommend, both on the legal front as well as the forensic front, doing that ahead of time.
I'd like to just make a comment. This struck me also in the article too. You were talking about all these nitty-gritties for legal protections of the hospitals and then maybe in some cases the affiliated doctors. And yet at the end of the day, there are these essentially quasi, or now I think they're, from our last presentation a month ago, they're now considered in some cases domestic terrorists or terrorist organizations overall. And they've essentially somehow, I don't know what the legal term is, manslaughter, murder, whatever, they've engaged in activities that have created actual physical harm.
Sure.
And so I don't know, I find it quite striking. We're talking all about this legalistic and protections of civil entities, and yet there was real physical harm committed by this entity. I mean, is there a conflict, a contract, or is there just, how do we balance that? Striking.
Yeah. And, the legal protections that I'm talking about, I don't want that to seem callous. What I'm trying to talk about is legal protections that protect the patient as well. So, making sure that we are thinking about things ahead of time. But when you're in the throes of a ransomware attack, the reason to try to pull on that veil of confidentiality is you don't know what happened to you at first. And if you start putting out a lot of misinformation to the public, you're going to get peppered with questions that you cannot answer that can lead to further safety concerns for patients. So if you can give yourself just a little bit of breathing room to try to get your brain wrapped around what just happened to me from a criminal perspective, and you are right. I mean, you have been attacked by a criminal. And one thing we have not mentioned yet is the interaction with federal law enforcement. Oftentimes we are working, sometimes it's the feds that notify you, it's the Secret Service, it's the FBI. They're saying, hey, we've noticed some of your data is on the dark web or whatever. But oftentimes it's you reaching out to the federal government. You have to file IC9 reports before you can pay a ransom. But even before that, we are working with the federal government to see, is this particular criminal threat actor that has just hacked into our system and made us a victim, that we're going to now have to defend ourselves to the world and also at the same time protect our patients. Is this entity, do you know anything about them? Are you going after them? Are you extraditing them? And what we're finding more and more is that the feds do have certain threat actors on their radar. And we have had in the last year situations where they ask our clients to participate and help them actually bring down and potentially extradite. And we actually helped bring down, one of the major threat actors that was pretty awful. So there is a lot going on from a criminal perspective. And you're right, it is a criminal investigation. There's also a very important need, and I cannot stress this enough. A lot of times by the time lawyers get involved and the outside forensic professionals get involved, normal IT kind of people that keeps their job is to whack moles all day long and keep systems up and running. And a lot of times they will blow up servers and blow up logs to try to keep the system running. And these are logs that are important to be able to defend the hospital, to know what happened, and also to know whether or not the integrity of your data has been messed up. So not only are we worried about confidentiality of data and just posting of confidential data, but you're also worried about the fact that a threat actor could potentially be trying to change medical records and kill patients. And we have had a couple of situations, money aside, when threat actors are trying to change medical orders to get bigger ransoms. We've only had one or two of those, thank the Lord. But, that's when the stakes really are high, is when you have the integrity of a medical record that might be at issue. And so if you're blowing up logs, trying to recover systems to get people back up and running, there's no data there to know what happened to the data to even know if patients have been harmed in that respect. Another thing that we commonly see is because backups happen about every 24 to 48 hours, when you cut off, to try to mitigate a ransomware attack. And so you cut off systems from the backup so that malware is not trickling over to the backups, so that you're not encrypting your backups as well as your main systems. When you unplug, you're not getting that feed from that day or the day before over to back up that particular day's worth of data. And so what we often see is there's going to be a gap in the medical record for about 24 to 48 hours. That's also an integrity issue, and having to deal with the safety concerns around that you might have had test results that were flowing. How do you even know who those patients were? If you've lost all that data, how do you deal with patients walking into your facilities when you don't know that they're there and for what reason? So having to deal with those operational issues from an emergency management and disaster recovery perspective is huge. Having an alternative communication system in play is also very big, making sure that you know how to talk to your staff and talk to individuals to be able to communicate without a threat actor watching you over your live systems is going to be key to a lot of this, as well as physical security of your facilities, whether they've hacked into your security systems for your doors and your video cameras.
Great. Well, Gina, I'm gonna just take a little prerogative here. We want to say thank you for now, and
sure,
we're going to save some time for more Q&A at the end. But let's head on to Brian now and get his perspective.
Sounds great. I look forward to hearing from Brian. Thank you.
Great. Thank you.
Thanks, Gina. Thanks, Rich. Pull up my slides here. All righty, everybody able to see that now?
Good to go, sir.
All right, I'll kill my video to make sure we don't have any bandwidth problems. But as introduced, I'm Brian Gallagher, and it's really an honor to be with you guys today. I just want to talk a little bit about my background to give you a little bit of context. So I actually began my career in medicine as a EMT and then a paramedic. And so I have a little bit of insight into the medical stuff, but not as much as you guys. And then I went on to join the U.S. Secret Service, where I work in their technical security division. So I wasn't just one of the guys in the dark suits and sunglasses. I was also one of their cyber super geeks, which is what applies to this part of the conversation. Gina mentioned the Secret Service during her talk. Most people don't realize that they're one of the lead agencies related to cybersecurity in the United States from a federal law enforcement perspective. And so I like to highlight that. Over the course of my career, my time at the Secret Service, I had the honor of serving with 2 U.S. presidents. First was President Bush, the second President Bush after 9/11, and then with President Obama. And being an underachiever while I was in the Secret Service, and I went on to earn my master's degree in computer forensics and cybersecurity. And I really saw this intersection of physical security and cybersecurity coming together. So I wanted to be able to be better equipped to really protect our national interests. I had a wonderful career in government, loved every minute of it, but I ultimately felt I could do more for our nation in the private sector, and ended up leaving the government in about 2013. Anytime I'm giving a talk, I know people like to fall asleep, especially on Zoom. So I like to try to bring a little bit of humor to wake up the crowd when I'm giving a presentation. So, what's the elephant in the room that we're going to be talking about today, or what have we been talking about? Obviously, it's cybersecurity and ransomware. But specifically, I'm going to start focusing on the role that we all play in protecting our organizations. So I'm going to ask a quick question and like you to just throw your answer in the chat. But in 2020, so 2020, how many days on average do you think it took for an organization to detect a cyber intrusion within their systems? Any guesses from the crowd? Give you guys a second.
340 days.
Yeah, so I see 340. I see 21 coming in. Any others? 57, 120. All right, starting to flow here. 1 year. Yeah, so the vast majority of you guys are right, which is a surprise. So in 2020, the stat was actually 207 days on average to detect that an insertion had occurred. And then on average, it's an additional 76 days just to contain that threat and get it under control. Most people don't realize that. So when we're thinking about the medical industry, or really any industry, how much harm can a bad actor do in almost a year's time before something is exposed? So you guys know this is why we're here, but over the past 5 years, the biggest hacks in history have occurred. Malware has actually increased by 2,000% since 2016. And if we're thinking about this, it's really an unchecked plague. Cybercrime is now costing the global economy approximately $6 trillion a year. As measured by GDP, cybercrime will be the 3rd largest economy in the world, which is just a mind-blowing statistics. And over the past year, companies have been subject to litigation, obviously, as Gina was talking about, civil action, and even criminal penalties for failing in their duties as data fiduciaries. Making the situation even worse, there's currently over 3.5 million unfilled cybersecurity positions around the world, and 500,000 of those are right here in the United States. By the end of next year, by the end of 2022, we're expecting the need will exceed 1.8 million here in the US. So we can't just throw people at the problem because the people aren't there to address the issues. The only way that we're able to combat this is really, to help organizations stay cyber safe, will be to effectively leverage frontier technologies, and most notably, from our perspective, really bringing artificial intelligence and machine learning capabilities into the whole cybersecurity sphere. So realizing this is what led me to start the two companies that I currently lead, both Protected by AI and CodeLock. And when I decided to start those companies, the first thing I did was reach out to an old buddy of mine, Dr. JT Kosman. Many of you may know who JT is, or Dr. Kosman as he prefers to be called. But for those of you who don't, I can sum it up. He's widely recognized as being the world leading thinker in applied artificial intelligence and cognitive computing. Feel free to look him up on Google. You'll see, thousands of entries related to him. And so, in addition to starting our companies, JT and I collaborated together on a book, which we intended to really be a public service for all of us, for all of you on this call. And I'm proud to say that it became an Amazon bestseller. So our intention with writing Stay Cyber Safe, what every CEO should know about cybersecurity, was to give you a simple understanding and overview that you could hand to the less technologically sophisticated people in your organization. And so, members of your leadership team could understand what the challenges were from an executive level and be able to understand what they need to do about it and why it really matters. I always like to point out, yes, you can get this on Amazon. Our goal wasn't to sell the book, so I'm happy to send a free copy to anybody. Just feel free to reach out to me. So, healthcare. In the book, we wrote about how badly businesses in every industry are being hit by cybercrime, and more specifically ransomware, and what they can do about it. That being said, I mentioned I started my career as a paramedic, as did JT. So the industry that we've been most concerned about is both healthcare and medicine as a whole. With this audience, I feel like I'm preaching to Noah how to build an ark. You guys are going to know a lot better than I do what's going on in medicine and how this is relevant to that, specifically related to data and digitization. And I'm also sure you know better than me that healthcare has also been far behind the curve in giving all of you the resources you need to keep that data safe. I kind of think this is a little ironic, but it's true. We've heard stories just like this, but hospitals specifically are obviously a target. Gina mentioned HIPAA, and we know that the powers to be take HIPAA seriously for the most part. But I suppose that the threat of massive fines and prison times and all of that can help the healthcare officials focus on this area, which is where being a data fiduciary really comes in. But as medicine's really increasingly becoming virtualized and digitized, our exposures and the dangers are increasing by an order of magnitude. The gentleman who asked the question, I apologize for forgetting your name, but he was talking about really the IoT devices around the healthcare industry, jumping up to 88%. This is becoming a huge issue. More things are connected, more data is being created, and there's more ways to access it. I'm sure you guys have all heard about concerns with EHRs. This is an article that came out by Fortune magazine, just kind of highlighting how nurses, physicians, even President Biden has talked about the faults, flaws, and all the security efficiencies inherent with these systems. It's a great article to take a look at. At the beginning of the call, Rick shared with us the horrific story that happened in Atlanta. This was, just to reiterate, the first death that was actually caused by ransomware due to a hospital being attacked. And this single event really is going to change the stakes for the medical industry, and really for all of those stakeholders who are focused on the outcomes of ransomware. As you expect, things are only getting worse. We're living in a world where even surgeries are being done robotically these days, and even remotely. So how long before hackers and state actors take control of the system, right in the middle of a procedure or an operation? It's a big deal, and it's one that we really need to be taking seriously. So, in protecting your organization against the risk of cybercrime, against the risk of ransomware, I often find it helpful to really define the problems that we're trying to defend against. So in our experience, cyber assaults tend to come in three forms. The first is extraction, the second is going to be obstruction, and the third is going to be an insertion attack. And Gina hit on these at a high level, but let me just dig in a little bit deeper. So an extraction attack is just what it sounds like. It's basically when the bad guys are going into your system and trying to steal data. We've been dealing with these attacks since like the 1980s, essentially happening through an organization's firewalls. Obstruction attacks are also what they sound like. These are your DDoS and your man-in-the-middle attacks. Basically, when somebody is trying to disrupt the operation of your network. For the most part, they're not really harmful. They're more or less annoying to what you're trying to do. Although they can be harmful within a medical environment. If you were to obstruct a needed service, like the situation in Atlanta. But the third, and arguably the most important, in our opinion, are insertion attacks. And these are when the bad guys are going to inject some sort of malicious or malevolent malware into your system. And it's going to metastasize and spread like cancer, not to use a medical pun, but it's exactly what happens throughout your system. And in fact, most of the ransomware attacks are going to start with some sort of insertion. Their goal may be to extract data out, but they have to insert some sort of malware into your system and infect your code in order for the action of the extraction to happen. So this is exactly what we saw with the Solarwinds attack. A few dozen lines of code were inserted into their Orion product, and it really crippled both companies and government agencies around the world. The odds are that one of you on this call was among the 18,000 SolarWinds customers who found themselves a victim. We know through public disclosure that SolarWinds attack targeted Mount Sinai Hospital. There were several other hospitals and medical organizations that have come out in the post-analysis of that event. So I wanted to kind of take just a minute and tell you about my own experience with the SolarWinds attack. My company, Protected by AI, we were working on a project with DHS. And later that week, we were meeting with the senior leadership, their CIO, their CISO, and a couple undersecretaries. And lo and behold, it's the same week that the SolarWinds attack was announced. Given the stat I started with, the attack actually happened way back in the beginning of the year, but it wasn't discovered and disclosed until December. And so going into that meeting, we knew that they weren't going to want to talk to us about anything other than the attack. So the day before the meeting, my business partner, JT, he calls me up in the morning and he tells me, he says, "Hey, Brian, I solved it." Of course, I asked him, "You solved what?" And he said, "I solved the threat to, I solved the problem related to the threat to intrusion attacks. I figured out how we could have stopped SolarWinds from ever happening." And he proceeds to go on and describe the technology and mathematics that he came up with. And I couldn't believe it, but he was right. He did figure out how he could have stopped it. So of course, staying on the whole, lawyer topic, within an hour, we had our IP attorneys on the phone. And the next morning, we had patents filed and was able to share this information with DHS, and they just went nuts. So what did we share with them, and what did we come up with? Well, we came up with a product called CodeLock, and CodeLock is really the first and only solution that's going to continuously monitor software at the code level. CodeLock will also completely eliminate any and all threats of intrusion-based malware. Now, we know that's a bold statement, but that's not our assessment. That's actually an unprecedented endorsement that we got from DHS. So you'll see right here, the legal office from DHS allowed this to be released. And the senior leadership in their science and technology team, after evaluating CodeLock technology, said that CodeLock appears to have the capability to stop the most sophisticated criminal malware. And then they went on to say, with respect to cyber attacks from hostile nation states, CodeLock would also be effective against all but a few. In fact, they originally wanted to say it would be effective against all, but you know how those lawyers are. Sorry, Gina. They made them edit that and put the few part in for the release. So I had not seen Gina's slides before this presentation. She showed us a slide of a castle, and it's really the metaphor that we all in this industry, really look around. So it's not enough to just think about, you know, the walls and raising the drawbridge, you know, or even filling, you know, the moats with sharks. But you have to start thinking about how you're going to protect your organization from within and how you're going to protect your systems at the most basic level, which is the code that it's written on. Whether it's fair to us or not, the women and men on this call, you know, those of us in leadership positions, we now have the responsibility. It's up to us within our organization to be the data fiduciaries and be responsible for an attack happening. There was a comment about the Atlanta incident and both the doctor and the hospital getting sued. Well, I guarantee you that the leadership of that hospital will also be named personally in those lawsuits moving forward. So we have to, you know, think about our responsibility, think about the legal ramifications for not doing something ahead of the time. Playing dumb is no longer an excuse. You can't, you know, open up your Google News app or turn on the TV without hearing about some sort of cybercrime. So how do we fix it? What do we do? You know, the reality is this here. You know, most people think that what we need is a cyber superhero. You know, a tech geek isn't just enough, and that's what we try to bring to the table when we're working with organizations and helping them to understand the threat. So I kind of talked a little bit fast here to make up on a little bit of time, but expect that you guys have a lot of questions. So I'm happy to entertain any of them and talk a little bit more detail. Rich, back to you.
That was real. That was really terrific. And it's interesting. You know, you honed in on the same example I did. I was just wondering. You know, this continued. This is this small rural hospital in Alabama. I mean, you know, they would think like, why us? I mean, how much could they even possibly have in terms of cash reserves? They're probably got almost no margin. So what at the end? I mean, a lot of these people, they just don't have the resources to pay. What do they do? I mean, these are by little hospitals.
So a common misconception is that it's always about the money. I was doing an interview with Barron's, the news outlet yesterday, and we were talking about this very topic, specifically related to what was happening with at the White House yesterday. The president was hosting a ransomware summit, right, with 30 other nations. And so the goal of the cyber criminal is not always to get that ransom paid. And you have to realize that. If it's a nation state actor, if we're talking about China or Russia, it could be just for intelligence gathering, trying to create a data lake. It could be to expose information on you know, a political target. It could be to get data into their ecosystem that then they can then use to expose a hack of somebody else or to blackmail an official. So it's not always just about that payment that's actually happening.
I posted something at the beginning of the chat, if you didn't see it, the Lazarus Heist, which is a podcast that runs 10 episodes that is gripping, talking about the North Korean hackers who, for the most part, it's a focus on money for them, but they are incredible in terms of the level of detail and what they've gone to do. I mean, truly quite amazing, and for all of the reasons that you described, Brian.
Well, and think about think about North Korea specifically related to Sony. Yeah, were they trying to get money? Sure, but why did they do it? They were pissed that that Sony was put out the movie that was making fun of their their dictatorship leader. So it's not always about the cash. And just kind of going back to the comment of, hey, we're a small hospital, why us? Well, frankly, you're probably an easier target because you're not focusing on it.
So I want to highlight a question from Jim. I know he's on, but I'll ask it. He wrote, given the apparent lag between an intrusion occurring and being discovered, how are most intrusions discovered? During routine system audits by demands from the attacker, I'm going to guess at this and say, right at the time that your screens go, you've been hacked.
Yeah, so it's all of the above. I was on a call this morning with the CEO from a food service company in Michigan this morning, going through an attack that they had that was ransomware. And I asked them that very same question, how did you know you got attacked? And he kind of laughed and said, well, when the screens told us we were. And so, that's common, when you see that. Sometimes, it can be picked up with logs and analysis. But that's the exact reason that we actually came out with CodeLock, since it's focused in at the software level of the code. It's going to instantly alert when there's an intrusion. So rather than waiting 207 days, you're going to know day one that something happened, which is really how this is game changing and why DHS is so excited about it.
It's funny, I asked a similar kind of question I'm about to ask a month ago. If I said, for those of you that don't know, in like the early 1700s, before the United States, pirating was quite a big thing. And the British government or the colonies who were independent would issue letters of marque, which basically gave a ship the ability to act as a quasi-marshal or quasi-member of the Navy and going after pirates. So one wonders about the equivalent, if not necessarily storming in and breaking down the doors of a hacker, but somehow rewarding anti-hackers to go after the initial ones, so that you're leveraging the network effects and the savviness of other computer people against the attackers.
Yeah, so one of the things that just came out by the FBI, I think the Attorney General did a posting last week. They're looking at putting together, sort of citizen-based, groups for different aspects of this. Now, there's a challenge with that from the whole vigilante perspective. You can't go in and just start pen testing, people and looking for problems and things along those lines, because you get into other legal issues. So I'm not advocating for whether that's a good or a bad idea. We'll see how that turns out. But yeah, it's a problem that we all need to be partaking in. It's not something that the federal government's going to fix on their own.
Hire me hearties. Thanks, Richard, for allowing me to get my background with the pirate hat on.
Thank you. I noticed that, Nick. So, but Brian, along a similar theme, like I read an article just the other day that there are these companies that provide hacking software so that to make your, become a criminal overnight, basically. And then these other criminals use the software, and then the guys who provided the software actually find out which client, which entity is about ready to pay a ransom. And then they jump in, take over the software themselves, and then they collect the ransom. So there almost seems to be like this ability maybe of the FBI or whatever entity to set up a pseudo hacker software company and essentially create a sting operation to capture some of these folks.
Yeah, and believe me, they do that. One of the challenges that you're seeing from a federal law enforcement perspective is budget and resources. So this is such a massive epidemic. It really is that there's just not enough law enforcement to deal with it. So, they're having to, when I was in the Secret Service, whether we were looking at counterfeit currency crimes, or electronic crimes, we had to focus on the big fish and the big cases. And I wish that wasn't the case, but you get hacked and you call your local police department, there's nothing they can do for you. And it's just the reality of the situation that we're in.
So for the benefits of people asking questions, Leo, you've got your hand up. I've got a couple of questions in the chat, which I'll either ask or ask the folks who asked them. So Leo, do you want to go first?
Sure, thanks, Nick. Real quick. I was going to say that one of the ways to avoid all the difficulties that are associated with the vigilantism, and I think the biggest thing, and our guest can probably go into this a bit, is attribution. Taking down a ship in the days of the piracy was pretty clear. They flew a flag or they didn't. You captured the ship, you knew who they were, and that's that. Cyber criminals, attribution is very, very difficult, except for organizations like the FBI, the Secret Service, and nation state entities, and it takes them a while to be sure what's going on. However, there is a way to marshal talent, and that's these what are called bug bounty programs. or HackerOne, several of these organizations that have been used by the Pentagon and private sector widely, where you open up your systems in a controlled way to very talented hackers who are looking into your systems, and they are looking for your weak spots, and they only get paid generally if they find it. And that's a very, very cost-effective way to mobilize talent to defend yourself rather than mobilize to attack the attacker, which is far more difficult and legally fraught.
The only comment I'd throw on that is you need to know who you're dealing with. I see Gina spoken as well on that because it's a great, hey, come hire me to, let me come into your system. Well, I'm the bad guy. You don't know who I am.
Yeah,
exactly.
Exactly.
So those programs need to be very controlled.
Is working with the Defense Department or somebody else. There's a handful of them out there that are very well known, and that's the way you would do that. But they're highly vetted. You can look at all the information that's available to how they vet their employees. You have total visibility into what they're doing every step of the way, and you have a kill switch anytime you think something is disruptive. So, I mean, this is a well-established mechanism that I think is very, very valuable.
I don't disagree, but remember, if you're representing a healthcare entity, they have to be able to meet the business associate requirements and the vendor vetting requirements. And so, make sure you are dealing with reputable organizations. We often find, black hat, white hat hackers, black hat by night, white hat by day. When you're dealing with local IT companies, you want to make sure you vet them as well. We have actually had IT companies hack into systems and drop malware to try to sell products. We have had outside vendors hack into security systems of hospitals to try to prove that you need this new firewall or you need this new application on your system. So just know that, you got to be careful, but I don't disagree that some of those are great ideas.
Thanks. I'll just add, if you're in doubt of any of what you just heard, go to DEF CON just one time and you'll learn that immediately. I want to be sure of time. So Afshin, I'm going to ask you to ask your question of Brian, because I think it's a slightly shorter answer, or I can read it out, whichever is preferable. You're on mute, so I'm just going to read it out. So does your coder need to recode the application? Would CodeLock have its own code that runs on your hardware?
No, it doesn't run. I don't want to bore everybody on the technical piece, but we put a hashing algorithm that's in a blockchain-like structure that gets inserted in via a comment as a non-operational code into your system and looks at a callback back to a server. And so happy to take that offline with you. Throw my email in the chat, to go more technical, but probably the vast majority of the people, it's going to be over their heads. So,
thank you, Afshin. Did that answer your question? I'm sorry, I just for the purposes of time, I was.
Yes, it does. I'll follow up with him if I can get it in. Perfect. Thank you.
Thank you. I want to be sure to get Lloyd's question in, and then I'll come to you, Jim. Lloyd, do you want to ask it?
Yeah, well, frankly, I'm wondering if either of you have any quantitative information on what's wound up being a successful hack. For example, what's the breakdown between hacks that were successful because the target had bad security versus hacks that were successful because they were using an untrustworthy vendor like Solarwinds? Kind of on the same side, is there any difference in success in attacking cloud-based versus on-premises systems?
So from a statistic perspective, I don't have any that speak specifically to that. I haven't seen a breakdown or an analysis that way. Not sure if Gina has something different.
Okay, just opining here. This would seem like something that the cybersecurity authorities ought to be collecting and distributing.
I'm sure, but there's no collective body that's collecting. Yeah.
Okay. Just to confirm, because it looks like there was a lot of questions about the form, and I think Gina, thank you for posting the correct one, I think. There were a lot of guesses, it appeared, for the numbers that I saw. Jim, do you want to ask your question? We're almost at time, so I want to make sure we wrap up on time for Brian's benefit.
Yes, please. And first of all, thank you. This is fascinating information to both Gina and Brian. I got to say, listening to this, the requirements that an institution has to go through that has been hacked, it sounds much more punitive than helpful. And I'm wondering what help an institution could look for. Clearly, they need to hire a law firm. Clearly, they need to find a security company or a cybersecurity expert to help them. But you did mention something about either CMS or the FBI maintaining records of prior hackers. Are there any instances of somebody being able to defeat a hacker by unencrypting their data? What can they do besides, I mean, so much of the reaction from authorities seems to me to fall in the category of piling on. You know, you've been hacked, so now you've got to do whatever you do, and you've also got to spend all this money to notify people of a data breach, and you might get a fine and yada, yada, yada.
Brian, you may be able to speak. Yeah, you can speak probably more intelligently to this than I can. There are definitely groups out there that you can join to kind of share intel. Yeah, the FBI, we have found the FBI and the Secret Service to be very helpful, particularly in addressing wire transfer fraud. So if you have a wire transfer fraud and you can get that message out to the right entities, to the bank, as well as to the right federal authorities, that can stop those very quickly. And a lot of it depends, from my perspective, Brian, you've probably got a better perspective on this, of what they're focused on and whether or not they feel like they have a real good shot at bringing that threat actor down. If other countries outside the U.S. are cooperating, you know, with bringing that threat actor down, they seem to jump on it. There does seem to be more of a, you know, there are definitely websites and groups you can join to share intel, to get the whitelisting sites and all that. But when you report these, I mean, don't expect them to be calling you back every 5 minutes telling you what's going on. It's definitely more of an outgoing stream of information from you to them. But we do find results, you know, months later, typically, when we do share intel.
Yeah, I agree with that. You know, two other things. I just put a link to CISA, which is DHS's entity, in the chat, and I'll throw one in for an FBI group called InfraGard. You know, InfraGard has locations in you know, chapters all over the country that you have to get vetted into and cleared, you know, via background checks as a private citizen to be able to get vetted information. So, I mean, I guarantee you, for the people on the call whose organizations, you know, have a dedicated chief information security officer, they should be plugged into these types of networks. If they're not, you may not have the right person in that role. So, you know, consider that. But, you know, the sharing of intelligence, at least within common industry and with the authorities to the best of their ability is you know, is common.
Okay.
All right, so I think we're at almost at time. I want to be sure there's no more questions. A couple of more minutes left, but if not, we can close out the recording. I'll pass off to Richard and Jim for any final closing thoughts, but thanks to Gina and Brian for great insights. You know, remains a fantastically challenging area with people involved, because they tend to be the weakest link, as my British lady friend says in the show, unfortunately, and it's very hard to sort of combat that, but there's some interesting approaches to it. So thanks to both of you. Thanks to everybody for participating. Richard, any closing thoughts before we close out with Jim?
No, I just want to thank our speakers very much. This was great, and the perspective was wonderfully broad, and keep up the good fight.
I'd add my thanks to that. I'd add the thought that we all remember the Medstar breach a couple of years ago and how much that cost them. But despite that, I find that it's typically pretty difficult to get a healthcare CEO to really focus attention and money on this issue unless they have already been hacked. They sort of think, I've heard the heard more than one of them say, I'm not going to get one nickel's worth of credit for avoiding something that never happens. And
they will lose their job though. That's the thing they don't realize.
I have an interesting concept around that. You can demonstrate a dose response mechanism for closures of roads associated with marathons. So the Boston Marathon, you see an increase in morbidity and mortality. I think you can show the same thing with cyber breaches and ransomware. The challenge I have, I've been trying to put a paper together. Nobody will give me the data to demonstrate that because, of course, they don't want to show that they had a dose response of morbidity and mortality. So I think it's possible. You just need somebody that can squeeze. Maybe all this reporting, if I could get access to it from Gina or Brian, I'll put a paper together that will give them the investment potential.
Frankly, one thing you can do that will cost you almost nothing is to have somebody try and spearfish your own staff. Offer them free tickets to something if they just click on a link and enter their email. And this is the cybersecurity equivalent of having a camera in the bathrooms to see how many doctors, are washing their hands. That will cost you almost nothing. And I would guess that if you told your CEO, okay, these are the number of people that went for the free tickets and these are what privileges they've had, it would be impressive.
Just final thoughts. I know we're right here at the hour, but educate your board, educate your C-suite before an attack. Let them know all the things you're doing to prevent an attack. It's kind of like the analogy of TSA keeps all the terrorists off, but the only one you hear about is when the planes hit the building. Make sure you're giving, for those of you who are warring and warring this daily, make sure to give yourself credit before an attack, because if you don't, you'll have a lot of fingers being pointed. Know before is a one way to it's a product that they use to test phishing scams, very similar to what you're talking about, to test employees, and you can get a lower your rate and pull them in for training. But it's a technology that actually sends out sample phishing scams to see if you have habitual clickers. And then the only other thing that I would say is just make sure that that you get in front of your CEOs and your boards and make them understand stories like this last one that's going to take me 2 seconds to say. I had a hospital that had carbon black, which is a form of endpoint monitoring, running through its systems. It got hit the same day as another hospital that did not have it. Hospital number 2 was down for almost 2 months. And I don't even know how much operating costs, multi-millions. Hospital 1 was back up and running within hours of getting hit. So having that endpoint monitoring and being able to detect early and that prevention, it saved that hospital millions. And ironically, the amount of per day costs that they lost in profits for that hospital that did not have it was identical to what 1 year of what carbon black endpoint monitoring would have cost that hospital. So it's worth the investment. And if you need people to scare the crap out of them, I am sure that Brian and I can accomplish that task.
Well, I think you've scared all of us. So I thank you for doing that. So
all right, I'm going to wrap up the recording. You guys can stay on, but let me just close out. Thank our speakers. This is Health TechNet. Will be published on the web in the usual YouTube channel. I'm Dr. Nick. I'm principal at ECG. Thanks for joining us today.